I'm Lucy Hicklin. I'm a consultant ENT surgeon. Do you know, I can't really remember deciding. I always wanted to be a doctor from, I don't know, when I was, I suppose, in my early teens. My dad was a doctor. I thought it would be interesting. I thought it would be fun. And it was, and it is. Well, I actually chose my specialty for fairly practical reasons. I wanted to be a surgeon. I was very good at surgery, but I didn't want to be a general surgeon. And at the time when I was doing my training, the general surgery path was really, really hard, lots of nights and not, ever being at home. And I knew I wanted to have a family. And then I did an ENT job, and I found that people could do lots of interesting surgery and have a life as well. So it suited me really well. There's so many interesting things you can do in ENT, and in the end I ended up doing mostly laryngology, which is dealing with the voice box, and rhinology, which is nose and sinuses and things like that. But I've done everything along the way, so it's just a lot of interesting things to do, and to be able to spend time with my family and do normal things as well. So it's been perfect. I mean, as I said earlier, I find it very interesting, very stimulating. I'm still doing lots of research and giving lectures and teaching other doctors and students. But I think it's the patients, really. I just love meeting people and trying to help them with what their problem is. So it's just great all round to be able to meet lots of people, hopefully help them in whatever is their problem, and it's very interesting and rewarding. I think I'm a really good listener, and lots of people that I see have seen lots of other people before they've seen me, and quite a lot of doctors in my experience tend to shut people down, or they don't actually let them tell their story. And actually what I found throughout my career is if you let people talk and tell you their story, usually you get to the bottom of what the problem is. So I think they appreciate the fact I listen. I try and talk to people in a way that they can understand. So rather than using lots of jargon, I try and talk in just a normal way, so that they understand what's happening and what the plan is. And I think I'm quite a nice person. So people generally enjoy seeing me. Not everyone, obviously, but I think patients like the fact that I listen to them, and I explain.